Our topic for today is Montelukast. One of the series of questions that came up toward the end of last calendar year were some of the psychiatric adverse effects with other medications. So that was how this particular medication got added to the schedule. Our objectives for today are going to be to list the neuropsychiatric adverse effects. We're also going to look at some of the prevalence data to try to help predict which populations seem to have the biggest risk for developing some of these neuropsychiatric adverse effects. Now, as most of you are probably familiar, Montelukast is one of the medications that's been approved for treatment of both asthma, excuse me, and allergic rhinitis. It has consistently been in the top 50 prescribed medications in the United States. The last data I was able to find was from 2019, and over 25 million prescriptions for Montelukast were dispensed. So still something that's used relatively commonly. It originally, when it had been approved, was seen to be relatively safe. They didn't see a tremendous number of adverse effects, and it was used pretty commonly, especially in relatively young patients. From there, they had a couple instances where a teenager committed suicide, which resulted in an outreach and collection of data and the initial warning in 2008 about some of the neuropsychiatric effects. This was then updated in the spring of last year. So this might have gotten missed a little bit, but in March and April of last year, the FDA did update the black box warning for Montelukast. So specifically, this came right from the prescribing information. It states that there's serious neuropsychiatric events that have been reported with Montelukast. It's essential to discuss the benefits and risks, recognizing that the risks may not, the benefits for a particular patient may not necessarily outweigh those risks, especially in light of other treatments that are available. They encourage monitoring for the neuropsychiatric symptoms and recommend discontinuation if any of them do occur. Now, this warning isn't specific for Montelukast. Xalutine and Montelukast also have the same black box warning. So this was really kind of done as a package. But as I mentioned, the Montelukast is prescribed much more frequently. So what exactly is it that we're talking about, these neuropsychiatric adverse effects? There's a whole bunch of them. So as it mentions, it's some neurologic symptoms as well as some psychiatric symptoms. So here is a whole list that have been identified, excuse me, as potentially occurring with the Montelukast. Some of them have been reported a little bit more frequently. We're going to look a little bit more in detail at some of these. The anxiety, the agitation and aggression, the depression are definitely going to pop up, the sleep changes as well as the suicidal behavior. Not that I don't think the other symptoms are important, but just from trying to collect the data, they weren't quite as readily available. So what do we know? What do we know about how commonly these neuropsychiatric events happen? There is a report. So this was the updated neuropsychiatric events with Montelukast post-marketing experience data that was released by the FDA. At the bottom of the slide, there is a link. It's an entire slide set. I think it's about maybe 29 or 30 slides that the FDA did release that I used a handful of information from. So you can go right there to see the full disclosure. So in here, they were looking specifically at the neuropsychiatric events. They split it into two. So they looked at suicide, and we'll look at that data in just a second. And then they looked at some of the other neuropsychiatric events. They pooled the data from the FDA's adverse event reporting system. And they were, I apologize, I have been battling pneumonia and bronchitis, and I still have a little bit of a cough. So they pulled the data from this adverse event reporting system. For the neuropsychiatric events, they looked from January 17th through the end of May. And then for suicide, they looked from February 20th, 1998 through the end of May. Why they looked at them differently, I'm not exactly sure. And actually that should be January 17th of 1998. Not 2008. So I think they might have specifically been able to tailor it down to suicide. Maybe they just weren't capturing that in January of 98. So this looks at the trending of data from 1998 all the way through 2019. As you can see, there are a handful of spikes that occurred, and they were thinking that these number of reports were due to kind of increased marketing, increased awareness. The update in spring of last year was not necessarily done because there was a huge dump of information that said that this is a bigger problem than what they thought. It was really a result of, they believe this is a continued problem that healthcare professionals as well as patients are not being educated on a regular basis. They weren't as familiar, so they wanted to draw additional attention to it. So as you can see, there have been a handful of spikes. The light blue line is all of the adverse events that are reported. The dark blue line are the psychiatric, the neuropsychiatric events specifically. And as you can see, at least in 2008, those were pretty tightly matched. So most of the adverse events that were being reported were the neuropsychiatric ones. As we get a little bit later, we see a bigger difference where there are still quite a few neuropsychiatric events being reported, but they're not the main, they're not all of the adverse events that are being reported. There are quite a few others that are being reported to the FDA. So when thinking about that, who are the people that this is affecting the most? So this was also taken from that slide deck. The blue line are your adult patients that were on Montelukast, and the gray line are the pediatric patients, so those that are 17 and younger. And as you can see, for the neuropsychiatric events in overall, it goes from 1998 all the way to 2019. We did see a relatively significant spike in 2008. Again, this was about the time that the teenager did commit suicide, about 2 weeks after the patient had been prescribed Montelukast. So there was a lot more attention, a lot more publicity around that, which may have contributed to a lot more disclosures and reporting to the adverse event system. As you can see, the adults really closed the gap by 2013, and the adults actually have more neuropsychiatric events being reported in 2018, 2019 than in the pediatric population. And we'll look at another cohort here in just a couple minutes, and that seems to hold true. The overall incidence of the adverse effects does seem to be a little bit higher in the adults. So in trying to pull apart how common are these adverse events? When they looked at a handful of those adverse events from Montelukast, they quantified them, they categorized them, that's the word I'm looking for, as withdrawal effects. So the patient experienced the effects and they were discontinuing the medication, or they discontinued the medication and then they showed up afterward. So of all of the results that were tabulated in that FDA report, they found 15 specific cases where it was probable or very highly likely that these events were due to the Montelukast. And in them, about 60% were symptoms that started while patients were on treatment. So the symptoms that were reported are listed here. So we see that abnormal behavior, the aggression, the anxiety, some of the mood symptoms with the crying, as well as suicidal ideation. And then when the Montelukast was discontinued, for those patients, it was nine of the 15 patients, those symptoms actually continued for at least a week or two after the patient had stopped taking the medication. For those other 6 patients, they actually started experiencing some of these symptoms when they discontinued the Montelukast. And again, it was thought to be highly probable that it was medication related, and that was why these were included. So something that we can see when patients are on the medication, but also potentially when the medication is discontinued. So overall, 15 doesn't seem like a whole lot. Is that how prevalent it is? Well, we have a couple other cohorts that we can look at. So this was a survey that was done. They used an outpatient pediatric in adolescent clinic. So individuals that were 17 years and younger, and they reached out to patients that had been prescribed Montelukast. So new prescription for Montelukast. So there were 232 patients. Of those, only 106 completed the interview, and it was done, I believe, over the telephone. The median age was 5, about 3/4 of them were 8 years old or younger, so a relatively young patient population. Of these, they found that the reported neuropsychiatric effects were aggressiveness, irritability, and sleep disturbances. So the sleep disturbances were drowsiness, insomnia. Insomnia was a little bit more common, as sleepwalking, night terrors, as well as dream disturbances. The prevalence, it was about 16% of the patients definitely had a neuropsychiatric event that was linked to the Montelukast. And then 12% had a neuropsychiatric event that they thought was probably related to the Montelukast. The onset was about a week after they had started the treatment. In all cases, they discontinued the treatment when those neuropsychiatric effects occurred. They were all categorized as mild or very mild, and they resolved thereafter. The median time for resolution was about 2 days. So this is looking a little less than 20% of patients experiencing some type of neuropsychiatric event. Being that that was only one cohort, I wanted to look at what else we could find. So this was a matched nested case control trial that was conducted in Canada. Again, it was a younger patient population with asthma. And they picked any of the patients that had asthma between 2004 and 2015. They categorized them either as having, and they had to be on a prescription, but it could be any prescription. So 898 patients did have a neuropsychiatric event, and then they had 3,497 that had asthma that were on treatment, but did not have a neuropsychiatric event. When they looked at all of the data, they found that the odds ratio for having a neuropsychiatric event while on Montelukast was 1.91. So those patients on Montelukast were about 2 times more likely to have a neuropsychiatric event. And as you can see, that table that's on the right-hand side, anxiety as well as sleep disturbances, primarily insomnia, were the most common. They did have quite a few mood changes as well, and then personality changes, a diagnosis of schizophrenia, and agitation were much less common. So those were all in pediatric patients. So I tried really hard to find a cohort study that looked specifically at adults. Most of the data that I was able to find for adults was just in suicide, but this was one that included both pediatric and adult patients. So this was an analysis of side effects since 2016 in 2 large databases. So they used the Netherlands Pharmacovigilance Center and then the World Health Organization's Global Individual Case Safety Report. So the Netherlands had a much smaller cohort, a little over 300 patients, and the World Health Organization, their database, they had over 17,000 reports. And this was adverse events from the Montelukast. So what they found is the most commonly reported adverse effects for patients that were on the Montelukast in these 2 databases. So depression, those mood symptoms, that was relatively high. Aggression, suicidal ideation, insomnia, anxiety, the abnormal behavior, and nightmares. So again, really relatively common. Depending on which cohort you looked at, the odds ratio really ranged, but in some cases it was 6 to 8 times more likely to have these type of events on Montelukast. So One of the problems with this data set, though, because that's significantly higher than what we just saw, it's a selected population. So this is looking at individuals who are reporting adverse effects from this, not the entire group of patients that are on the Montelukast. So that may really be the upper end. For these two cohorts, 2/3 of the patients that reported adverse events were the adults. So even though it included pediatric patients, the vast majority of them, over 65% of them, were adverse events that were reported in adults. So recognizing that agitation, sleep disturbances, aggression, so that's not great. That may not necessarily be fatal. There is quite a bit of data looking specifically at suicide with Montelukast. So this came from the FDA presentation. So they were able to identify over that time frame from 1998 into the 2000s that there were 82 cases of completed suicide. Of those 82 cases, 54 were male and 22 were female. The highest number of cases was reported in the time frame between 2005 and 2009. There were still cases that were reported thereafter, but that was when the vast majority of those cases were reported. I believe it was over 50 of the 80 are reported in that time frame. In looking at the age distribution, so they had a couple completed suicides in patients that were less than 10, but the age groups that looked to be at the highest risk were those that were 14 to 16, 17 to 19, and then those that were 50 to 64 years of age. So almost a bimodal distribution there, potentially other considerations for the older patients, but definitely something we wanted to keep in mind, that it does look like maybe there is a pretty high risk group in these adolescent to young adult patients. There are a couple other cohorts that I just wanted to talk about briefly. I was only able to get abstract data and not the full text from all of the articles, but there are a couple other databases that look specifically at suicide with Montelukast. So the World Health Organization's database does collect suicide information. They had suicide reports of over 6,000, and approximately 10% of those patients were on Montelukast. Something that threw a little bit of a kink into that was that a number of those patients were also on other medications that have been associated with an increased risk of suicide. Corticosteroids, for example, but there were other medications. So it wasn't incredibly clear that it was just due to the Montelukast itself. There are two other larger databases. So one was in Sweden, and it looked at data from 2001 to 2010. And in their suicide rates, they only had one patient in that time frame that was on Montelukast that had a probable association with a completed suicide. So that was significantly lower than that 10% in the World Health Organization database. And then in the UK's database, they had over 23,000 patients, and they again had only one suicide over a short period of time, although it didn't give what those years were that they were looking at. And they did not feel that that was associated with the Montelukast, even though that patient had been on it. She wasn't currently taking that, and she did have a history, a significant history of treatment refractory depression. So suicide does happen. It does appear to be associated at a higher incidence than in patients who are not taking Montelukast, but it's not clear that it is a direct association, and we don't have a ton of information to be able to stratify risk. In the prescribing information itself, it says based upon the available data, it's difficult to identify risk factors for and quantify the risk of neuropsychiatric events. With that in mind, the suicide data that is available does show that it's more common in younger patients and in patients who are male. So they may be a little bit of a higher risk group. Interestingly, for the rest of the neuropsychiatric events, when we look at those other cohort studies, it's more common in adults, and it tends to be much more common in women. Only about 1/3 of those reporting those neuropsychiatric events were male. So there does look to be quite a bit of variability within that cohort. So just being mindful that these do happen with patients who are on Montelukast. These are the official FDA recommendations for use of Montelukast. So asking them about their psychiatric history, because I forgot to mention this, in the FDA data, only 13% of those that had completed suicide did have a documented psychiatric history. So it wasn't necessarily only in those patients that did have a history of mental health concerns. Making sure that we're educating patients and advising them about these effects that they could see, and that we're screening for these potential side effects, especially earlier in treatment. And if they do develop those adverse effects, that we are discontinuing therapy. So Montelukast therapy has been associated both with neuropsychiatric events as well as suicide. The strength of that relationship, we still need additional data to be able to further clarify that, but educating all of the patients just in case would really be helpful, as they may be, adults might be at risk for those adverse effects, and those younger patients may be at a higher risk for suicidal ideations. And monitoring them throughout therapy really is going to be essential.